Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I'd like to just talk about my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you may see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. Question number 1 states, the patient has a confirmed diagnosis of H. pylori. The nurse practitioner is planning triple therapy for treatment. How long should the treatment be prescribed? Is it A, 3 days, B, 3 to 5 days, C, 7 to 10 days, or D, 7 to 14 days? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first. So the stem of the question here states, how long should the treatment be prescribed? So, all right, we need to figure out what treatment we're even talking about, right? So this patient has a confirmed diagnosis of H. pylori, and the nurse practitioner is planning triple therapy. Remembering our triple therapy, I tell you to think of CAP as its three letters, right? Your CAP for your clarithromycin for C, your amoxicillin for A, and then a PPI for your P. So, the ones that end prosol, like your omeprazole, your pantoprazole, things of that nature, okay? But how long should that treatment be prescribed? And the best answer is D, 7 to 14 days. I know it's 3 different medications they're taking, but yes, you take it for 7 to 14 days. And, it's actually proven that the 14 days has a 5% efficacy over the 7 days. But again, you can prescribe it anywhere from 7 to 14 days. All right, question number 2. The nurse practitioner is discussing triple therapy versus quad therapy for H. pylori with the NP student. If there is a resistance to clarithromycin, which therapy should be used? Is it A, triple therapy, B, quadruple therapy, C, doxy for 7 to 10 days, or D, doxy for 3 to 5 days? Take a moment and tell me what you got. All right, so STEM here states, if there's a resistance to clarithromycin, which therapy should be used? All right, so the nurse practitioner is discussing triple therapy versus quadruple therapy with the NP student for the management of H. pylori. But if there is a noted and documented resistance to clarithromycin, you want to go with quadruple therapy. Remember, we talked about that in the other video. That's commonly the reason why we utilized quadruple therapy, because remember, with triple therapy, it's CAP, CAP, triple, 3 letters, C for clarithromycin, A for amoxicillin, and B for the PPI. And there's a lot of areas that has heavier resistance to clarithromycin, so it's best to treat with the quadruple therapy. So B is your best answer. And then lastly, question number 3. The nurse practitioner and NP student are discussing the typical duration of quad therapy for H. pylori. What shows appropriate understanding? Is it A, 5 days, B, 7 to 10 days, C, 3 to 5 days, or D, 10 to 14 days? Take a moment and tell me what you got, you guys. All right, so the stem of the question here states, what shows appropriate understanding? So what are we understanding? So the nurse practitioner and NP student are discussing the typical duration of quadruple therapy for H. pylori. So how long do you typically prescribe that quadruple therapy for H. pylori? And the best answer here is D, 10 to 14 days, okay? All right, you guys, I hope you found this helpful. I wanted you to look at it from a different perspective because, like I said, we went from a knowledge base to an application base, but I also want you to understand the duration of the levels of when we utilize our antibiotic therapy as well, so that you are learning the full the full perspective so that any way that questions may be presented to you, you're able to pivot. But as always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you're looking to review independently, I offer a self-paced review. It's also linked in the bio of this channel. My QBank options are linked in the bio of this channel. And if you're looking to book a one-on-one session, you know I always say reach out as they are customized options. So I like to gauge what you truly need. And it's going to be most beneficial for where you are in your studying journey so that I can assist you most effectively. So I always say reach out so that we can determine what's best for your scenario. But as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.